Flatline. Your patient is dead. An ER doctor takes death personally. See, we think, did I do everything I could have done? Did I react soon enough? And the room is so quiet. The air is so heavy. That right there, that's the soundtrack to my trauma. So that's the sound you hear right before someone flatlines. That means, Doc, let's go, let's hurry up, let's save their life. And I heard that sound too much during the pandemic. I hear that sound in my dreams. It's my alarm clock because I cannot sleep through it. I'm trauma bonded to it. Now, we have all heard that term. It's okay to not be okay. But never has that resonated with me more than it does right now. Now, if you don't remember anything else from today, remember this. It is okay to not be okay. I'm saying that to all of you, but as a reminder to myself. My name is Dr. Pamela Buchanan. I'm a board certified physician. I've been practicing for 19 years in private practice and emergency medicine. More recently, I bought a mental health practice. And I still need to be reminded it's okay to not be okay. Because I remember my not okay moment. It was during the pandemic. And during that time, you can't imagine the emotional distress that doctors were going through. As for me, it was weighing heavier than I realized. You see, there's this bridge that I cross every day to go to work. And as I would cross this bridge during the pandemic, when it was apocalyptic outside, nobody was outside except for us, oh so lucky essential workers. I would cross this bridge, a steel gray bridge over the murky Missouri River, fog covered. And something would say to me, jump in, jump in, over and over. It would say that. And it was so distressing. And then I realized something. I was depressed and suicidal. Yes, me, Dr. Pamela Buchanan, was depressed and suicidal. It's hard for me to admit that because look, I'm tough. I'm like Ford tough. And like if a work truck was a person, that's me. And so I just carried on. I pushed through. All right. And then I tried to work it away. I tried to pray it away. I had a Peloton. I tried to spin it away. None of that worked because I was ashamed. I was so ashamed that deep, dark moment in my life that had me contemplating suicide, that was my emotional flatline. Now, after I tried to power through and carry on, I realized that I couldn't do this on my own. A friend of mine who was a doctor committed suicide. And I said, okay, I'm not okay. Let's get some help. And you think it would be automatic, like the hospital would have something in place, but they did not. They were so happy to shove a hose up my nose if I so much as sneezed to test for COVID, but nobody asked me if I otherwise was okay. So I went about the business of finding a therapist. I called 10 or more therapists, looking for somebody with availability who took my insurance. I thought I found one. I get to her office and she says, yeah, but no, I don't take your insurance. All right. I had to pay out of pocket. I'm so lucky I could afford it. And you know, therapists, they all do the same thing. They're so nosy. And she was like, so tell me about your childhood. And so we go into how when I was coming up, I would be with my mother and people would say to her, what's wrong with that baby? That baby ain't right. Is she slow? And my mother was saying, there's nothing wrong with her. She just is different. I thank God for my mother. She was before her time. See, this was the 80s and the 90s, and nobody was diagnosing Asperger's and autism or ADHD. My mother got me tested and realized I was gifted. I went to different special classes and I thrived. And at these classes, I saw a lot of weird looking kids. And I looked at these kids like, wait, am I weird too? At that moment, I was okay with that because I found my tribe. But the problem was how the world viewed me as not right. And years later, things still didn't change. I was at my mother's funeral, and the pastor who gave the eulogy actually said, y'all remember the slow baby? Well, she grew up to become a doctor. And everybody's laughing and chuckling. My daughter, who was 12 at the time, nudged me. She said, Mama, you slow? It was a little bit embarrassing. The problem is, in our society, we view people as slow and not right. And that's got to change when people have neurodivergence and mental illness. There should not be any shame associated with this. And I do my daily work with patients who flat out do not believe in mental illness. They look just like me and they say, I don't believe in that. Even though 37% of African Americans have a mental illness. And that's about 5 sold out Super Bowl stadiums, so that's a lot. And we have about 970 million people worldwide, according to the WHO, have mental illness. In America, 24%, or roughly 57 million, which is twice the population of Australia, have mental illness. 45% of Caucasians, 37% of Hispanics, and 25% of Asians all have mental illness. So why am I sitting in my office convincing my patients that this thing is real as if it's the Easter Bunny or something? I know what it is. They feel that shame, that stigma. Nobody wants to be associated with it. And so in this moment, I go into superhero mode. Put on my lab coat like it's a cape. Call me Captain Sable. And my superpower is authenticity. I let my patients know, I know you don't want anything to be wrong with your baby, but listen, if there is something wrong and we intervene early, we can help. I understand. I overstand because I live it. I'm on the spectrum. I have ADHD. I got chronic depression, and I've learned how to navigate this world. So in that moment, they soften and they're ready to receive what I have to say. And that's a win. And think about it like this. Why is there so much shame? Because there's no shame with saying you have the flu or you broke your leg. But the moment we mention mental illness, people shut down. Listen, when you're sick or you broke something, you go to the ER, you go to the urgent care, you go see your doctor, it's automatic, no shame associated. But when we are so depressed, so down, that we can't get out of bed, not that you don't want to, you cannot, or your mind, it's reeling. It's going a mile a minute. And you are worrying so much that you worry about worrying. And then comes the chest pain. And the walls close in, and you can't breathe. That right there is a time when you should seek mental health care. But what most of us do, we shut down and we go, soak it up, man up, and you power through. When we should seek help. But in these instances, I try to talk to my families and friends who go through the same thing and let them know, listen, if you have a mental illness, you should seek care. And they say, girl, you know, we don't do that. And my Christian friends, they go, I'm too blessed to be stressed, right? But what is so exciting right now, I've been a doctor since 2005, and we are living in a phenomenal time. See, mental health is having a moment, and it's about time. I'm so excited. I'm celebratory. I'm from St. Louis, and when we celebrate, we go bow, 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 bow. That's how I feel about it because we're having a moment. I hear rappers like Megan Thee Stallion talking about anxiety. I hear Simone Biles saying, I can't do this. I have mental illness. And so we're making progress. The problem is that healthcare services are not accessible to most. And the reason being is most psychiatrists, they take cash only. Insurance pays some pennies on the dollar. Well, we're in a great time and things are changing. I used to feel bad that I passed on some neurodivergence to my children. All 3 of them have some form of it. But my daughter freed me 2 weeks ago. She said, Mom, I love my neurospicy family. Neurospicy made me feel good, like it's a salsa dance. Or maybe it's a delicious Mexican dip. But anyway, it's way cooler than weird and not right like what I grew up with. So I, for one, am doing my part in this. And you go like, what can I do? What can you do? We can all do something. Listen, number one, you can start off by not shunning the mentally ill. Those in your circle have issues, be there for them. Number 2, know what's in your community. There's resources in every community. And number 3, Start a letter writing campaign to your insurance commissioner, to your insurance company, to the politicians. Let them know we're not okay with this. You're going to pay for our mental health services just like you pay for diabetes medicine, asthma, and the like. Listen, I'm convinced that I'm doing my part, being authentic. And if we all just do a little bit, we can make a big difference. It should be as simple to go to the doctor for a mental health problem as it is to go get antibiotics for a sinus infection. I cannot wait for that day. And I can only imagine a time when it's truly okay to not be okay. Thank you.